Hello everyone. In our last OET writing video, we have seen the purpose and expansion of purpose with relevant details, right? So in this video, we are going to discuss about choosing the right content. This is the next criteria. When writing an OET letter, selecting the right content is very crucial because it determines how effectively you communicate the patient's needs. So this content criterion focuses on the relevance and accuracy of the details included. Let's break it down further. What does the reader need to know? This is the most critical question you need to ask yourself. Your reader needs specific, actionable information that is directly related to the purpose of the letter. Here's how to determine what is necessary. You need to focus on the purpose first because that's the priority. So each OET letter has a clear purpose, whether it can be a referral, discharge, or transfer. Try to include information that supports this purpose. For example, in a referral letter, you need to include patient's medical condition, symptoms prompting the referral, and relevant history. When it comes to a discharge letter, focus on the treatment provider, the patient's current status, and the follow up instructions. Highlight critical information. What are the key details the reader needs to act on? You should be aware of that, right? It can be current symptoms or findings, ongoing medications or therapies, test results or investigations. So these are some of the critical information or the key details that the reader needs to act on. Also, you can include like precautions or specific instructions, okay, and leave out information that does not impact the reader's ability to manage the patient. For example, if the letter is about a cardiology referral, there is no need to include an irrelevant surgical history unless it is related to the heart condition. You need to keep one question in mind. Does the reader already have a relationship with the patient? This question helps tailor the level of detail you need to include. Brief introduction, for example, age, diagnosis, and presenting problem, relevant medical history and treatment, current status, and why the referral is being made, key supporting details like lab results or medications. So, all these things you need to keep in mind to include. Let's see an example. Scenario 1. A hospital physiotherapist is writing a discharge letter for Ms. Priyadas, who's transitioning to community rehabilitation center after knee replacement surgery. So the content requirements is given here. Since the recipient doesn't have prior knowledge of the patient, we need to include current mobility status, specific rehabilitation goals, any ongoing medications or precautions. And an example is given here. Ms. Priyadas, a 58-year-old, underwent left knee replacement surgery 3 weeks ago. She can ambulate short distances with a walker but requires assistance for stairs. The focus of rehabilitation will include strengthening exercises and balance training to enable her independent mobility. So this is an example. In this case of Miss Priyadas, a patient who recently underwent knee replacement surgery, the referral focuses on. So here it clearly states she can ambulate short distances with a walker but requires assistance for stairs. So this shows the current mobility status of the patient, right? Wherein it paints a picture of her functional abilities. And when it comes to strengthening exercises, the focus of rehabilitation will include strengthening exercise and balance training to enable her independent mobility. Here it clearly specifies the specific rehabilitation goals. So it gives the clear picture to the rehabilitation team what exactly they need to work on. And when it comes to additional context, so you can see here the timeline of the surgery has been given. Surgery 3 weeks ago. A 58-year-old underwent left knee replacement surgery 3 weeks ago. So it helps the recipient understand her stage of recovery. So remember, when referring for physical rehabilitation, always include the patient's current physical abilities and specific goals of therapy, any precautions such as limited weight bearing, or ongoing pain management. Here is another example. The scenario is a general practitioner is referring a long-term patient to cardiologist for further management of atrial fibrillation. And the content requirements here, since the cardiology has no prior relationship with the patient, we need to provide a history of the condition, current medications, and recent lab results, symptoms prompting the referral. Mr. Aaron Anderson, a 62-year-old with a 5-year history of atrial fibrillation, has been on apixaban and metoprolol. Recent episodes of palpitations and dizziness prompted this referral for further evaluation. His latest ECG and blood test results are enclosed for your review. So this is an example. So here you can see they have mentioned the condition, history condition, a 5-year history of atrial fibrillation, right? And it provides the essential context of the history. And when you see the current medications or the lab results, they have clearly mentioned the patient has been on apixaban and metoprolol. His latest ECG and blood test results are also enclosed for your review. So it gives you a clear picture that they have included ECG and blood results and also medications to ensure the cardiology has key data for evaluation and also the symptoms prompting for referral, right? Noting episodes of palpitations and dizziness. So it pinpoints why further evaluation is needed, ensuring a focused consultation. When it comes to referrals, for specialist referrals, you need to summarize the patient's medical history and current treatment. So these are the key tips that you need to focus on. Include key investigations and results relevant to the condition and clearly explain the reason for referral, such as worsening symptoms or a need for any advancement management. All these things you try to include in your letter. When it comes to the general tips for choosing the right content in OET writing, first, you know your reader. Tailor the information to the recipient's expertise and needs. Don't overload with unnecessary details. Prioritize relevance. Include only details that help with the patient's management, such as current status, medications, symptoms, and test results. Also, stay concise. Keep your sentences clear and to the point. Focus on what's critical for effective communication. Use medical language. That's the next step. You need to use your medical language. While the tone should be formal, ensure the terminology aligns with the clinical standards. And also check for completeness. Make sure your letter answers the what, why, and how. What's the issue, why the referral is needed, and how the recipient can help. How to choose and what content to include. This serves the most important part in choosing the right content. If the recipient knows the patient, focus on updates or changes since their last interaction. Avoid redundant details. If the recipient is unfamiliar with the patient, you need to include a clear overview of the patient's condition, history, and the current status. That's all for this session on purpose and content in OET writing subtest. We hope these tips and examples make your preparation easier. In our next video, we'll explore how to achieve clarity and conciseness while adhering to the required genre and style. Have questions? Drop them in the comments. Don't forget to like, share this video with fellow test takers, and subscribe for more OET tips. See you in the next one. Bye bye.